Welcome to the Aced It podcast, where we turn science into sense. In this very special season funded by the Bureau of Justice Assistance, we provide 10 timely episodes with the hopes of helping listeners understand what we can learn from current research that will help correctional staff. And please note, we did not just guess at what correctional staff need to know. We traveled the country, interviewing individuals working in prisons and jails, and the topics of these episodes are exactly what they asked for. So, I'm Danielle Rudes, your host, and here we go. In the previous episode, we discussed some of the primary challenges regarding the use of substances, like fentanyl and K2, within prisons and jails. In this episode, we switch it up and focus more on the treatment aspect of substance use disorders. Although medication for substance use disorders was not a highly discussed topic among the correctional staff in our project, it is an evidence-based practice that is showing tremendous promise in correctional settings. We selected 3 articles that we believe will help cover the basics regarding medication use for individuals suffering from substance or opioid use disorder in prisons and jails. Let's begin by highlighting some of the basics. In a systematic review conducted by Maurer and colleagues in 2019, the researchers highlight what previous literature has said both in general about substance use disorder and opioid use disorder, and about the effectiveness of medication-assisted treatment, MAT, distributed in prisons and jails. First, a little contextual background. The use of opioids has been linked to high levels of addiction, healthcare expenses, and mortality. This issue has been recognized as a significant public health problem in the United States. Opioid use is especially prevalent among individuals in the criminal legal system, recording higher rates than the general population outside of prison. Findings from the survey of inmates in states and federal correctional facilities indicate that 23% of the state's incarcerated residents and 18% of federal residents have used heroin and opioids at some point in their lives. Among criminally legally involved populations, opioid use poses unique dangers, as it increases the likelihood of a life-threatening overdose after being released from incarceration due to its increased availability and dangerous forms, like fentanyl. Therefore, it is imperative that individuals receive the most effective treatment while incarcerated and prior to being released back into the community. Medication-assisted treatment, known as MAT, is an evidence-based approach for treating addiction, primarily in opioid use. Through MAT, there are 3 types of medications used for treatment: methadone, buprenorphine, and naltrexone. Although they are all aimed to treat individuals using opioids, among other substances, their effects differ slightly. The most common and widely used form of MAT is methadone. Methadone is considered a full opioid agonist, used to stabilize individuals by reducing the symptoms of withdrawal and cravings, reducing illicit opioid use, and increasing treatment retention. Second, buprenorphine. This is considered a partial agonist, but is still commonly used. Buprenorphine also helps limit the use of illicit opioids, assists with withdrawal and craving symptoms, and increases treatment retention. Finally, naltrexone. This medication has not been researched as much as the last 2, but all the literature surrounding naltrexone still supports some evidence suggesting that it also helps increase retention in treatment and decreases the use of illegal opioids. However, the use of medication-assisted treatment is sparingly implemented in correctional facilities, despite the substantial evidence behind its effectiveness. This leaves many residents forced to go through withdrawal and/or seek the use of substances while incarcerated, as treatment programs are not always available, may have a wait list, or may not work. In the current study conducted by Maurer and colleagues, the researchers predicted that within the 24 studies found, there would be evidence that supports individuals on MAT would have 1, increased engagement in community-based substance use treatment, 2, reduced opioid use, 3, reduced involvement in criminal activity and/or a return to the criminal justice system through, like, corrections, 4, reduced engagement in health risk behaviors post-incarceration. Through their comprehensive review of the literature, their results showed that the impact of receiving methadone during incarceration on substance use treatment engagement after release was significant. Results from their meta-analysis also showed that residents who received methadone during incarceration were more than 8 times more likely to seek community-based substance use treatment compared to those who did not receive methadone. Additionally, methadone was also found to be effective in reducing opioids and injection drug use post-release, with rates of reduction being a remarkable 78 and 74%. Given the goals of correctional institution, these findings hold significant importance. Given that relapse in opioid use post-release is a significant issue, we turn now to a study of jails, where release often occurs more frequently. In this study from 2022, Evans and colleagues report on the results of what they call a natural experiment. A natural experiment occurs when experimental conditions occur naturally, without researchers setting them up. Evans and colleagues evaluated the recidivism outcomes from 2 similarly situated jails in Massachusetts, where the resident populations were comparable. The experimental condition was that one jail offered MOUD in the form of buprenorphine, while the second did not. The study outcome was post-release recidivism, which included incarceration, probation violation, or arraignment. The results are quite impressive. Evans and colleagues found that individuals were less likely to recidivate when they were housed in the jail with buprenorphine offered to them than the jail without that option. To be specific, when adjusting for history of interactions with the criminal legal system, they found a 32% recidivism risk reduction. The individuals at the buprenorphine jail also had lower rates of rearraignment and reincarceration and lower rates of recidivism related to property crime, but they found no differences in probation or parole violations. So that is really good news. There is also a strong finding and a well-discussed challenge with MAT and MOUD in jails and prisons, and that is that many jails and prisons do not have these treatment options. However, even when MAT or MOUD is present, it's not easy. A growing body of literature notes the extensive challenges jails and prisons face when trying to implement MAT or MOUD programs within carceral settings. To explain this, we will highlight a study done in 2019 by Ferguson and colleagues titled Advancing the Implementation and Sustainment of Medication-Assisted Treatment for Opioid Use Disorders in Prisons and Jails. In this project, the research team partnered with 4 prison and jail systems who initiated a program for using medicine-assisted treatment to treat individuals with opioid use disorder. Note that more than approximately between 25 and 68% of individuals incarcerated in the institutions of their study had an opioid use disorder during the study. Each prison or jail wanted to sustain or expand the number of individuals in MAT or MOUD treatment while incarcerated as they aimed to address the high risk of overdose and mortality after custody release. 2 of the sites in the study used agonist treatment and evaluated these individuals from the time they entered the correctional facility. 2 others focused on initiating agonist treatment and engaging with patients after post-release. In the 2 sites that gave treatment prior to release, 100% of the individuals left with an appointment to a community provider for up to 9 months. Within those 9 months, the show-up rate fluctuated from a range of 35% to 100% each month. Their findings showed that the screening and coordination of care taken by the facilities post-release improved over time. Additionally, one system was successful in increasing the proportion and total number of individuals who had received treatment. Even more interesting, though, were what got in the way of the MOUD treatment and what helped it succeed. When the institutions had increases in staffing and staff training, data-driven processes to facilitate change, and when they coordinated with other parts of the criminal legal system and kept contact with individuals after they released, they saw better MOUD outcomes. However, when there was limited funding or resources, inadequate institutional space or design challenges, cultural perception problems, problems with excluding or stopping treatment for certain patients, moving or transferring individuals, and/or faulty care coordination post-release, these factors hindered MOUD success. Ferguson and colleagues make a strong point that it is not an easy path to implement MOUD in prisons or jails, but it is possible with careful, thoughtful, and sustained work. Wow, that's a lot to take in. So let me recap a bit to leave you with some takeaways. This episode sheds light on using medication-assisted treatment for individuals with substance or opioid use disorders in carceral settings. Opioid use poses a great danger in the criminal legal system. Therefore, it is crucial that individuals receive effective treatment while incarcerated and upon release. Current data shows some promising findings for recidivism reduction and overdose prevention, not covered in this episode, but true nonetheless. Unfortunately, though, we also learned that the implementation of MAT and MOUD in correctional facilities is challenging, leaving many residents to suffer withdrawal or continue to seek a fix both while in custody and post-release. However, and leave it to me to reiterate the bright side, studies consistently suggest that medication-assisted treatment leads to increased engagement in treatment, reduced opioid use, and improved health and wellness outcomes. So, it is essential that correctional institutions recognize the importance of MAT and MOUD and implement programs that enable individuals to receive the necessary treatment and support during their time in prison and jail. It is also important that institutions help these individuals prepare for and plan for post-release treatment continuation so that when they are released, they have continued MAT or MOUD support that they need to stay clean and stay alive. Change is never easy, but with consequences like these, who needs easy? We just really need possible. This is absolutely not all you might want to know about MAT or MOUD in carceral settings. If you're interested in learning more, feel free to reach out to us or look for articles or studies that discuss the stigma of MAT, MOUD, and how that affects treatment usage and implementation. And also, you may want to read about residents' preferences for one MAT option over the others. There's a lot you can learn. But we promise you will never be sorry that you did. They say knowledge is power, and I couldn't possibly agree more. Thank you for listening to the ACED podcast. We love hearing from you. So if you have comments, topics to suggest, or some research you'd like us to cover in a future season, please write to me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And now, a whole bunch of thank yous. First, this project was supported by a grant 5PBJA 22AG00031 MUMU, awarded by the Bureau of Justice Assistance. The Bureau of Justice Assistance is a component of the Office of Justice Programs, which also includes the Bureau of Justice Statistics, the National Institute of Justice, the Office of Juvenile Justice and Delinquency Prevention, the Office for Victims of Crime, and the Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking. Points of view or opinions in this podcast are those of the host and the research team, and do not necessarily represent the official position or policies of the U.S. Department of Justice. Then, more thank yous. Thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriter, SHSU master student Jalen Magana, and to my amazing research team at both Sam Houston State University and George Mason University. The team includes Bryce Kuchmarek-McCune, Sydney Engel, Caitlin Bauer, Shalom Aganaya, Alexa Mata, Chelsea Narvi, Alyssa Toman, Miltonette Craig, and Wyatt Brown. And a huge and heartfelt thank you to Jason Luton and the team at Slonky LLC for their fabulous podcast production. Tune in again soon for another episode of Aced It.